Start the first of our Wednesday working lunch series. Just before I do get going, if I could ask you to mute your microphones, as we are recording this session, and a copy of this recording will be uploaded and provided afterwards. Right, so my name's Dave Crew. I'm Head of Business Growth and Employer Partnerships at Weston College. This Wednesday working lunch series, if I could just remind people just to mute their microphones, thank you. We are organising and delivering this in partnership with North Somerset Enterprise Agency and the Western Chamber of Commerce. So first thing I'd say is a very warm welcome to you all. We have had over 160 registrations for this event, which is incredible. So a personal thank you from me to all of you. We have employers on the call, business owners, managers. We have people from the NHS, people from councils, local authorities, and we have a huge number of people from further education colleges right across the country. So you're all very welcome. Thank you for joining us. In terms of Zoom housekeeping, if you could mute the microphone on the bottom left on your toolbar for us as we're recording. And we just want to avoid any feedback on the session here. So if we can just remind ourselves to use mute. And also the beauty of Zoom, as we're all, I'm sure, Zoom experts now, is we can use the chat box, which is at the bottom in the center of your Zoom toolbar. So please use this chat box to request information, provide thoughts, provide suggestions, introduce yourself, ask questions, as we will be pausing at certain points during this recording and this session. After this session, we will provide a briefing paper, which we will upload to the Education and Training Foundation website, which will also include a link to the recording of this session. So if you are free to make notes, but you will have access to a recording of this session, which will include the slides after this session. So I just thought I'd mention that. We can move on, Jane, if you like. So as I said, my name's Dave Crew. I'm Head of Employer Partnerships and Business Engagement at Weston College. I'm joined by Sam Mayhew, our Dean of Faculty for Inclusive Practice at Weston College, and Jane Vivian, our Catalyst Director for Projects and New Initiatives. So in terms of the Wednesday Working Lunch series, we decided that we wanted to connect with people. I'm sure you'll all appreciate that it's been a fairly challenging time for a lot of people across the country, regardless of where you work, in a business or especially in the NHS, local authorities and colleges and everywhere else. And a key agenda for Weston College and our staff is to connect with people, to share information, to educate and collaborate. And that's certainly the theme of this Wednesday working lunch. We've created 10 events. So this is the first, so I'm overwhelmed with the response. So again, thank you. And the focus of today is talking about mental health awareness and how we as employers, as owners and managers of businesses and business departments can support people with mental health, such an important issue. That's as much as I'm going to say on the topic, because I'm going to hand over to my colleagues who are the experts. And I'm now going to hand over to, before I give you a quick overview of Weston College, you'll hear from Jane Vivian and Sam Mayhew. So for those of you who don't know Weston College or don't already work with us, we are a further and higher education college based in Weston-super-Mare in the southwest of England. A key objective for us is being highly ambitious for our learners. I'm not going to read through all of those, but we have a very simple mission statement at Weston College. A little bit of feedback on the line here, so if I can just remind everyone to mute their microphones. Our mission statement is creating brighter futures. It's very simple. Ethos and culture is everything to us. And you can see from the accolades that we've received over the past few years, everything links back to that ethos. We're very, very passionate about mental health and well-being, and we're also a national centre of excellence for SEND. My colleagues will go into that in more detail. But for us, it is about supporting learners, supporting employers, and supporting everyone that we engage with to really create brighter futures. And at that stage, I'll hand over to Jane. You're still on mute, Jane.
Hi, I'm Jane. I'm going to be presenting shortly, but I'd just like to introduce my colleague Sam, who will talk about the Centres for Excellence.
Sam, I'm not sure if you're on mute.
Sorry, everyone. I was expecting someone else to unmute me. I was just sat here talking to myself. So good afternoon, everybody. And it's nice to see so many people here from right across the sector, from employers and businesses and to colleges that I've seen been introducing yourself on the chat. So I know that some of you have been involved in the first stage of Centre for Excellence, but a lot of you are new to this, so I just wanted to give you a brief update. And if you, sorry Jane, if you could just go back to the other slide, it went a bit quick then. But just to let you all know that there's 3 national centres across the country that are really working together to share best practice and to support you within the range of provision that you're offering for students with SEND, for students with any kind of additional needs or learning barriers. So there's Weston College, as you can see, in the southwest. We also have Derby College and also City College Norwich. So we work really closely together, and we all have a very different perspective on how we're supporting colleges, although there is some crossover, as you can imagine. But just to say, this afternoon, Weston College is really focused on people. So this session today is looking at how you can support from within your organisations the students and your employers with mental health challenges and difficulties. And we're seeing that there's been such a rise, obviously, of isolation. And so hopefully we'll give you some key pointers in things that you can do as an organisation to support the people that you're working with. Jane's going to take you through that national context of mental health this afternoon and the impact of the COVID-19. And again, like I said, sharing best practice. So the 3 centres have a real focus. Moving on, Jane, to the next slide now. For this next phase, so this is phase 2 that's launching at the moment, and some of you may have joined the joint webinar that we did with all 3 centres of excellence back in May, which really talked about some of the challenges that we're experiencing for students and employers working at this time. So our Centre of Excellence, as I said, focuses on people. There's 3. We've got our communities of practice. So all of you are welcome to join our communities of practice, and we can keep you updated with all the different activities that are taking place. Many of those will be virtually at the moment, as you can imagine, but we're hoping from January we'll be able to set up some more face-to-face sessions, and you'll be able to come and see some of the provision at Weston College and how we work with students with SEND. We've got a leadership hub that's through our principal, Dr. Paul Phillips, and he's really keen to be working with senior leaders around how to create that whole college approach, and really looking at the secrets to success around investment in staff training and really giving staff the empowerment to be able to understand the needs of the people that they're working with. So anybody who's interested or wants to forward the details of their senior leaders who might want to join his hub, then please do so. And like Dave said at the beginning, this is really now focusing on working with the community and working with employers right across the section, so we can really look at how people can be supported in employment, but also looking at opportunities for learners to go into employment and ensuring that there's that seamless transition between colleges and schools right through into their employment outcomes. So if we just take, I think it's moving on now, Jane, to you, isn't it?
Yes, it is, Sam. Sorry about that.
If anybody in the meantime has got any questions about the Centres for Excellence, then feel free to put them in the chat, and we can respond to you afterwards. But what we've seen from the first year of working is we've really been able to come together and share best practice across the sector and learn so much from each other. So it's been a really worthwhile initiative that the DFE have funded ETF to support.
Thanks, Sam. So we thought it'd be helpful, firstly, to set today's webinar in context in terms of mental health and wellbeing across the UK. As you can see from this slide, 1 in 4 people in the UK will experience a mental health problem in any given year. But only 25% of those people will receive any sort of support, which is, obviously really quite shocking. And actually 50% of that 25% will wait 3 months or more for any sort of talking therapy through their GP. And as we can understand from mental health, any time delay in getting any support can really make a problem a lot worse. So these statistics are quite shocking, and obviously were released prior to COVID-19, which we will come on to in a minute. So if we look at this then in terms of the context of the work environment in the UK, 8.4 billion is what mental health costs business every year in sickness absence, 15.1 billion in terms of reduced productivity, and 2.4 billion in terms of staff turnover. And actually, as a whole, 70 billion it costs the UK economy each year. And yet, as you can see from the infographic there, only 31% of the UK workforce have been formally diagnosed with a mental health issue. So actually, this picture is probably an underestimation of what actually the real picture is. And as I said just before, this is prior to COVID-19. So it's really shocking, and something that I think as employers and as colleagues and as organisations that deliver support to a number of people, we really need to get behind the mental health crisis and understand it and start to support people. So in terms of what this means to the UK workforce, there's a fear of, Mind UK have done some research, and there's a fear of silence and a culture of fear in the UK. Only 1 in 5 people, also should I say more than 1 in 5 people agreed that they'd called in sick due to workplace stress and how that had affected them. And only 30% of staff agreed with the statement that they felt that they were able to openly talk to a line manager if they felt stressed. And actually, if you then look at what that means in terms of kind of the impact on employees and learners, and the slide that we've just shown before about kind of the what's being picked up, that then can escalate into far greater problems if it's undiagnosed and unsupported. And 56% of employers said that they would like to do more to improve staff wellbeing, but don't feel that they have the right training and guidance. And we'll see why this is so critical in a minute. So I just wanted to take us back to the Health and Safety at Work Act 1974, which is still the most up-to-date legal position in terms of supporting our staff. There's a general duty within that act to take reasonable and practical steps to ensure the safety of anyone who might be placed at risk by your business undertaking, and that's any business undertaking. And there's also a duty of employees at work to take reasonable care of safety of themselves, but also those of colleagues around them. And I didn't really appreciate the full extent of this act, but actually what it regulates is workplace health, safety and welfare. And so actually, if we look at the context of the information we've just presented in terms of mental health and the impact it's having on the UK economy, welfare is a major part of that actually we are all regulated as employers and as organisations to look after. So obviously, COVID-19, I think we've still to understand the actual impact of COVID-19, but there's lots of research that's starting to come out. And after this webinar, I can share some links with you around specific mental health guidance and also research that's starting to come out as a result of COVID-19. But this graphic here shows you that, across all stages of life, COVID-19 is having an impact on mental health. And actually, as you can see from the column which is highlighted in yellow there, of a working age adult, there's a lot of anxiety, career stress, and also kind of financial worry and feelings of isolation that have been created by COVID-19, and we're not out of that yet. And as local.gov.uk has already reported, and Mind UK, that if the economic impact of COVID-19 is the same as the 2008 recession, and actually all indications are that it could be greater, 500,000 additional people will experience mental health problems over the coming years. So that's a massive ticking time bomb, and something that we really do need to explore and support really quickly. So you can see from this slide that actually, if you look at all of those different things that fall under the classification of mental health, they are not immediately recognisable when you meet someone. And I think that's the real problem with mental health, is that people suffer in silence, and actually things can be happening, people can be feeling a certain way long before they show any signs. And those signs can be both sort of in terms of mental health signs that we know, but also physical health. And I think it's actually really important at this point just to say we all have mental health. It's whether we've got good mental health or ill mental health, in the same way as whether we've got physical good health or physical ill health. And actually it's really important that as employers, as colleagues, that we actually learn how to recognise the signs of mental ill health early enough to be able to support people, and also to give people mechanisms and the ability to feel like they can talk about what's affecting them. So we're coming on to how we can respond as organisations across the UK. Again, the triangle on the left there, with the middle box, the yellow box, is centred around that 1974 Act, which governs us and requires us to protect the welfare of people, as well as their physical and safety within the workplace. And really, I think that illustrates really well that actually a lot of organisations have health and safety officers, they have first aiders, they have fire wardens, we have risk assessments in place, and employees have maps on walls and they know where to evacuate to in the event of a fire, and they know where the first aid boxes are. But how many organisations have something around mental health in terms of clear steps and clear signposts for people to gain support? And again, if we think about that Act, that 1974 Act, we have just as much requirements on us to provide that information as we do for first aiders and fire and risk assessments. Something that we as an organisation have been doing over the last 2 years now is creating a network of mental health first aiders. And we're really lucky to have a Mental Health First Aid England assessor and trainer who's gained their qualification and can deliver that course. And I myself have been through that course, and it's been a real big eye-opener and a fantastic opportunity that the college gave me in terms of looking at mental health first aid and spotting those signs. I think it's important to say that mental health first aid is about kind of listening non-judgmentally, giving support, assessing the situation, encouraging people to gain professional help, and we'll come on to some of the ways in which they can gain that help, but also encourage them to seek help from professionals. And as you can see from this slide here, the mental health first aid training follows the ALGI approach, which is a similar approach to any first aid. So it's around that kind of assessing, it's around that protecting yourself and from harm, and listening and preventing any further harm. As I mentioned, we are an organisation that can deliver this training, and I've put a link on that slide there, but obviously get in contact with any of us if you'd like to find out more. We were delivering it as a 2-day face-to-face course, but actually because of COVID-19, Georgie, who's our trained deliverer of the course, has actually just been on the mental health first aid blended learning qualification and gained that. So we can now offer it virtually over, I think it's a 4-week period. So again, there's lots of different ways that can be delivered to you and colleagues within the workplace. So I'll now hand over to Sam so she can talk about our transformational approach and what we've been doing.
Sorry, thank you, Jane. I think that what we found as a college is that we were seeing that there was a real need to look at how we were supporting the students and the staff's mental health. And we delivered, we really needed to take stock of what systems and processes were in place and what was needed. And we did a lot of analysis regarding conversations that students were having with their tutors, staff were having with HR. We were looking at the absent rates of staff and students. We were looking at the welfare interventions that were taking place, and it really gave us an opportunity to take stock of what we were doing as a college. And we used the AOC's guidance, actually, which is the Association of Colleges, and we can add that link in, which demonstrated to us what needed to be in place, and it gave us that grading criteria to look at where we were doing things that were really positive and had a really positive impact, and where we weren't. And what we've always found as a college is, in order to really take something forward, is it has to be delivered from the top. It has to be owned by senior leadership. So once we had established what we needed to do, it was then we came up with a strategy, and we created something. And Jane, you might want to just move on to the next slide, actually, because I think that shows it in a little bit. Is we created this framework called Body and Mind, and it was about bringing all 4 areas that were crucial in supporting staff and students' mental health and well-being together under this framework that we call Body and Mind. So there was human resources were there. We also had the staff that were trained in mental health, that were specialist practitioners that were part of the inclusive practice faculty. We'd already invested in high levels of training for staff. We had a few specialist practitioners at this point, but we were having so many referrals on a daily basis that we just weren't able to keep up with the volume of students and that were needing that extra levels of support. And we were seeing that students weren't able to access support through CAMS or through the early intervention teams, and there was long waiting lists. So in order to keep students engaged within the curriculum and engaged within their studies, it was important that we were able to, we weren't trying to take it to offer something that was being offered externally, but we were able to really work in partnership with those external organisations and have something in place that would support them whilst they were in the college. The specialist staff were crucial in working with the delivery staff, whether that be students who were out on apprenticeships or within faculties, for them to really understand what the students was experiencing and how their mental health condition was impacting on them, and some of the reasonable adjustments or small adjustments that could be made within an organisation to support that young person or that staff member whilst they were going through this period of crisis. From doing lots of research, we've obviously, and you will all be aware, the evidence that suggests that sport and activity is so important in people's mental health and well-being. So bringing that department together was also a key aspect, and also, of course, bringing welfare and pastoral to support together so that we had this framework. It was something that was branded, and it was about how we were breaking down the barriers for staff and students to be able to talk about their mental health, and for them to see that as a college we embraced everybody's mental health, and we had different strategies and different levels of support that were appropriate for different students. So that's our BAM framework that brought everybody together. We offer so many different initiatives and to staff and students. We have our own welfare staff member for staff members, as well as welfare for students. We have lots of different activities that are open for staff, different ones for staff and different ones for students, I add, but we've got the yoga that happens in the mornings for staff. It's about encouraging staff to be taking lunch breaks and making sure that they were able to access the gym that we have within the building, so that they could, and also we've invested in things like Les Mills. I don't know if any of you does the Les Mills workouts that include the kind of body balance, the body pump and the Zumba, so that staff could access these classes to be able to really look after their own physical health and then hopefully contribute to their mental health. And since we had this initiative, which was brought in 2017, we have seen that the absence rates have decreased, and staff are really out there accessing support. The other thing that we did, as Jane's spoken about, is making sure that we continue to have the high levels of training for staff. And like Jane mentioned, it was investing in a member of staff to be able to So she's delivered over 150 staff within Weston College on mental health first aid. I was just looking at some of the comments on the chat that other people were saying how important the mental health first aid has been. And as we can see that we've now able to offer that on a blended model or an online model, that will hopefully ensure that we can get the whole of the college through this programme of mental health first aid. We've created ambassadors that work within different faculties. We're using students that are talking to other students, so that it's a really open in the college, and everybody knows that it's really important that people keep talking about their mental health. It's embedded within the curriculum areas, it's in everything we do, and I think that that's where we've seen the success. We're not saying that we've eradicated mental health in any learners, but actually we've looked at ways in which we can support them. So just moving on to the next slide, Jane, if you could, just to put it in context, really, is that what we found through having our body and mind and our mental health strategy for the college is that staff feel really empowered and confident to discuss their own mental health needs, but also to support learners with mental health difficulties. Obviously, we know that in all organisations there's financial constraints, but actually technology has really helped with that. What we've seen recently when we've been accessing, we've all been off and working from home, is that some of the technology that we're using has really given a student a voice. We've also invested in something called the Big White Wall and Couth, and I know Jane will explain a little bit more later, but it's making sure that students have access to technology, support through technology, outside of the traditional kind of 9 till 5 college working day. We have so many cross-college events, and this has really helped with the breaking down of the barriers. We've had things called Mellow Yellow and Wellfest, that students take real pride, and it's really celebrated within the college, and it's not seen as something that people should be hiding behind. And again, like I said, it's about promoting the active lifestyles in and outside of college, and building the students' resilience, and for them to understand the importance of looking after their mental health as well as their physical health. The key to the success has been about working in collaboration, and we can make direct referrals to CAMS now. We have those really excellent relationships, and as Georgie would say, the best, one of the key things that she did when she came into the college 3 years ago was to get herself situated within every kind of external meeting within the local authority, within the NHS, so that she really felt she had a voice for the college and was able to access that information. And as I said earlier, one of the most important parts is that it's a buy-in from senior leadership. And I think in order to change the culture of an organisation and to change that ethos, it has to be delivered from the top. And we've been really lucky that our principal has really valued this and seen the extent of looking after his staff and the students, so that there is a short film that he's made around this. And unfortunately we weren't able to show it today because it's quite difficult using Zoom. But as Jane mentioned, we will have that onto the ETF website as part of the SEND Centre for Excellence. So if anybody wants to hear, how the principal did it and why he felt it was so important, then that's a really good resource for you to use, and maybe to show to other people within your organisation of the impact that this can have, by really investing in the CPD, the training, and that whole organisational approach. I think that we might have a short pause now for any questions that you may want to ask about this. I'm not saying I can answer every question, but I just think if there was anything that anybody wanted to specifically ask, then please feel free.
I'll move on then if there are no questions, but as we've already said, if you have any questions and that you don't want to ask here and now, pop them into the chat, because what we will do after today's webinar is to pull together a briefing paper responding to any comments or any questions that are asked, and send it out to you along with links to a number of the different resources and pages that we've talked about. So if you don't feel comfortable with asking any questions, just pop it in the chat. That'd be fantastic.
I think that somebody's just asked a question around how do we fund this within the college organisation, and that's a really, really good point.
Mm-hmm.
The specialist practitioners are funded through the high needs budget, and so that's how we fund those, but everything else within the college is done within the college's central budget, and I think that's why it has to be so crucial that it comes from the top and led by the senior leadership team, but it's using the overall college pot to put in the rest of the activities that take place.
Mm-hmm. And David, you've also asked a question about how many people you should train as mental health first aiders. I don't think there's any right or wrong answer there, depending on the size of your organisation. SMEs might have one person trained. If you've got a number of departments, then you might want somebody trained within each department. We've got them, as Sam mentioned earlier, we've got a whole network of mental health first aiders that are placed within curriculum and business support and lots of different areas, because obviously we all come across people in different ways. So we're more than happy to talk about an approach if you want to after today, but there's really no right or wrong answer to that question. So maybe we'll just take one more question, and then if we can pop them into the chat going forward, because I think we probably need to move on. But Sue from Weston Chamber has asked about how you got senior management buy-in to the transformational approach.
Sorry, was that to me, Jane?
Yes, sorry, yes.
Oh, sorry. Yeah, I think that our principal has always recognised the importance of this, and has always been very focused on the learners with SEND and creating that inclusive approach within the organisation. He would, as part of his leadership hub, Sue, if you wanted to ask for his support to maybe talk around that with your senior managers about what he's done and what the success has been, and how it really, the investment in staff is so crucial in being a successful organisation, then they could join that leadership hub, and we could arrange those meetings just to have those virtual at the moment conversations, if you think that would be something useful. And that obviously goes out to all people that have joined the webinar this afternoon. If you think that your senior leaders would be up for a discussion with our principal, then please let us know.
Absolutely. Thank you, and thank you. Keep your questions coming. So in terms of the next stage of our presentation, we're going to be looking at what we have in place to support both our own teams and our learners, but how we could support you as organisations, bearing in mind some of the information we've already covered around the welfare and the act that governs people to be able to support both employees and colleagues. We've got a number of distance learning courses that we've been offering now for a long time, but actually during COVID-19 we've seen a 9-fold increase take up in those, and that's come from over 20 FE providers across the UK, schools, and also employers and employees who are on furlough. And in terms of kind of some key statistics here, we've had a combined reach of 27,000, and a number of, as you can see there, the number of new learners has gone up dramatically, which is really encouraging, because I'll come on to what that learning's covering. And it's really encouraging to see that both employees and employers and organisations that have a duty of care are taking up the training. They're using this time to be able to sort of make sure that they're looking after the welfare of their staff and training people to be able to support people. We've also been putting out a number of blogs around kind of our offer, and the most recent one is around mental health, so please check that out. But again, I can drop details in the chat afterwards with a link to that. So in terms of those online courses, obviously the focus at the moment is online because we can't deliver face-to-face. One of the questions was around, in the chat function, around the mental health first aid qualification. Yes, it is a specific qualification. And as I mentioned earlier, we've just got licensed to be able to deliver that digitally via a blended approach. So we can still continue to deliver it during a period of time where we're not actually opening our doors to new learners coming in to deliver face-to-face. As you can see there, the courses that are most in demand, and I find this really encouraging, is actually around mental health, understanding behaviour and challenges, understanding people and mental health needs. You know, as I mentioned earlier, mental health is hidden, or mental ill health is hidden, and a lot of people don't show signs. So being able to pick things up, no matter how subtly, is really important. We've also just launched a personal wellbeing qualification last week. So again, that's around looking after your own wellbeing as well as understanding the wellbeing of others around you. And I've not obviously listed everything that those courses cover, but as you can see there, in terms of the key areas and content that they do cover, it links absolutely to some of the content we've covered previously in some of those statistics. So understanding stress and managing that stress, mental health and mental health issues, understanding a change and picking up on change and being able to support, and also approaches to supporting people with mental ill health. Another course that we've just been licensed to deliver is the Infection Prevention and Control plus COVID-19 qualification. Now, I know this isn't specifically around mental health, but actually what we're hearing through government guidance at the moment and through our own feedback with our own learners and the conversations we're having with employers, there's a huge amount of anxiety around people returning to the workplace. And actually, as an employer or a college or an organisation that has clients or customers coming in, being able to show that you're taking all reasonable steps to understand COVID-19 and protect people who are within your organisations can help reduce that anxiety. So it's an accredited qualification, and we had 68 sign up in the first week. I've listed some of the content there, but it is quite a detailed course. It's not a long qualification, so it can be done quite quickly. And I've actually just found out from our delivery team today that we've also got a COVID-19 secure e-learning course that's launching on the 8th of June. How that differs is it's focused around the workplace specifically, but also there's one for retail, and it's an e-learning qualification, so you can do it in your own time. So again, if you've got staff on furlough or colleagues on furlough, that might be a really good course to have a look at so that people can understand how to manage the best we can a return to work and reduce that anxiety around COVID-19. Just wanted to pause there. If there's any questions, we can take them, or again, we can respond afterwards. Maurice, you just asked about course fees. Yes, I can send those out after. I can send a full list of the qualifications that we're offering digitally at the moment and course fees to you.
I can see Jill's asking about, are we offering a trainer for mental health first aid, Jane?
It's the Mental Health First Aid England qualification, or it's one of those distance learning courses that I've just listed in the previous slide. But that will cover leading a team, and actually if you need something bespoke, let us know, because there's other qualifications that we can add to as well.
Yeah. Jane, do you mind if I bring a couple of people into the conversation at this stage? I think, are we okay for time? If we just briefly take a couple of points. I know we've got Emma Tate on the line from Sweet Construct. And Emma, I don't know if you mind unmuting your microphone, if that's okay.
Oh, hello.
Hello, Emma. I know that your business does a lot of work in the construction sector, and I know this is a key focus for that, well, for all sectors really. But would you mind giving your view on what you see in your business and what you see in your sector?
Yes, okay. I can't comment across the whole sector other than that it's recognised as a critically important concern. There are various articles, even this week, that have been published. I think there's one particularly in Construction Manager magazine talking about the mental health across the construction industry, and 2 suicides a day. We could discuss for ages the reasons behind all of that. So across the industry, certainly it's a concern. Within the business, I think we handle it very well. We have a lot of time given to mental health, even to the extent that it almost felt like it was overkill. And when I'm working with early careers and apprentices, you kind of feel like it's almost off-putting coming into a company where you spend every other meeting talking about mental health and so on. So we're very focused on it. We've got 6, I think, mental health first aiders qualified across the business, including in HR, but actually on the sites as well. And obviously we work with an awful lot of subcontractors, and you kind of lose a little bit in translation when you're working with those that are not directly employed by the company. But we do lots of toolbox talks, which is team meetings basically on the sites, where they bring in the key leads for the subcontractors. So it does get an awful lot of focus. I did raise a query earlier in the chat, though, that I think sometimes you can provide, all the signage, you can provide all the training, I'm sure there's more training that we could all be doing. But I know that my young guys are very dependent on me and my role, the role that I provide for them as Auntie Emma, if you like. And it concerns me that there will be other young people out there who may be new into the industry, who are a little bit nervous. It's a very male-orientated industry. Maybe it's the tough guy thing and you don't want to put your hand up and say, hey, I don't feel too good. And I just wondered if there was some kind of survey or something that we could use that, I'd like to circulate something anonymously and just kind of try and gauge how they were, particularly my audience, but maybe broader across the company, how everybody was feeling, and just capture some feedback anonymously. And that sometimes is a really good way of getting the attention of the leadership team that you were mentioning earlier about, it's got to come top down. And it's certainly on the agenda in the company, I have no doubt about that. But I just think sometimes it's really good to just test the water and not just keep putting out all the official things, but actually just gauge people's feedback and assess how effective it actually is. But my sense within the business I work in is it's very good, it's very well managed. There's always more we could do, but across the industry, I think it's generally horrendous, and it's extremely concerning that we have this challenge.
Okay, thank you so much, Emma. And I'm sorry I did put you on the spot there, so I appreciate you coming in, and I'm sure you'll get me back in some way. But there you go. But lovely to see you and talk to you. Thank you, Emma. I'll hand back to Jane.
Thank you.
Sorry, I just having to unmute myself. So we've talked about, obviously, mental health, and we've heard from Emma about what they've been doing as an organisation and some of the issues that they've been facing. Just to let you know, Emma, as Sam covered earlier, part of the SEND Centre for Excellence is an employability hub. So we are doing more work with employers to understand people. So mental health obviously is a key part of that. So, if there's anything we can do to support you with that survey and that understanding, then please let us know. So this slide really demonstrates the breadth of the wider support that we've put in place as an organisation. And again, I'm not suggesting all of you go out and purchase and put in place all of this, but we felt it would be useful for you to understand some of the tools and platforms that we use to support our learners and our staff. And that then you might be able to either mimic some of these, or we're more than happy to speak to you about how it works and put you in contact with people. So the Couth is for our young learners, and it's an online portal where they can access support when welfare isn't available. And it works a bit like a chat function, so it is really interactive, it's quite informal, it's not frightening, and again, it's that whole having a safe space to share how you're feeling. Obviously, we've talked quite a lot about Mental Health First Aid England today already. We've also, and Sam's covered BAM. So these logos don't look like they represent much, but actually sitting behind them is a whole range of activities. As Sam's talked about, the BAM activities are, all the way through the year, really interactive. It's about looking after staff and learners' mental health and well-being, and feeling that they're supported. And big white wall in the middle there, I'm going to cover that in a little while, but that's a key tool that we took the decision to bring into our organisation, and actually it's been a real godsend, and actually the use of that is going up all the time. And I did notice that a couple of you in the chat function have mentioned that you've actually brought this tool into your organisations as well. On the right of your screen, you can see the directory of useful services. This is something that we've put together as an organisation to direct staff and learners and visitors and any of our employers that are taking up our services to any of the mental health and wellbeing support that we offer directly, but also there's useful links in there to other support services. So we'll send a PDF out after this webinar to you, along with the links. So again, if there's anything in there that you'd like to hear more about or to contact us about, please get in contact. I'm just going to hand over to Sam now.
Sorry, I think I might be on mute still.
We can hear you, Sam.
Oh, great, I'm back. Okay, so I just wanted to give a little bit of context really around some of the things that we've been doing since we went into lockdown, and how looking after the learners. And I can see some of the chat comments that you've been making around some of the initiatives that you've been working through with the young people that you're supporting and teaching and working with. So our college went into I obviously had a couple of days notice, like many of you, to develop an online remote platform for all learners to access. Luckily, because the college had already had a digital strategy that had been working on for the last 2 years, many of the learners were already familiar with using Microsoft Teams, which was what the college decided that the platform was going to be for this learning. So that students were already familiar and had some confidence in understanding what was going to be expected of them as they moved into this new type of learning environment. The principal has come up with My Virtual College, which is something that everybody across the college, staff members participate to on a daily and weekly basis, to really share across the organisation how we're engaging with young people and how we're supporting them, so that to ensure that no learners, however vulnerable, at home in their isolated environment, and for many young people that don't have supportive families that they're living with, that really the support from the college was even more crucial. So where students were receiving support on a one-to-one basis for an hour a week through a specialist practitioner, we've seen that that's increased to sometimes daily for that hour a day. But it was really bringing structures and routines that we were seeing that the students were so desperate for whilst they were at home and in lockdown. So this is some examples here of some of the things we've been doing with the students. It's been a great opportunity, as I said, to share practice across the organisation, to learn from other practitioners about different ways of innovating and creating aspects that students will really engage with. We've seen many learners that have actually increased their attendance. Now we're remote, it removes so many of those social barriers and those environmental factors that creates learners have such anxiety around travelling to college, being in large groups, having their say, having their voice heard, that actually we've seen that the impact for some learners has been we didn't anticipate that would be the impact for some of those learners. And I think as a college we've really learned that moving forward, this blended approach where it's a mixture of remote learning and face-to-face for some will be a key aspect, especially through tutorials and students accessing learning that's an appropriate time for them, and not feeling like if they've missed the first half an hour of a session that they're not able to access it because they could be listening to the recordings. We had a visit from one of the ministers, but just before half term, to really share how we were working with the apprenticeships and those learners with SEND, to see that, you know, that there are other ways rather than that face-to-face. And I think for all of you colleges that are listening this afternoon, it's kind of now looking at how we move into that phased return, so that students are still able to access the support. And we think that the support will be going on all through the summer. Although the college is, you know, the end of term is at the end of June, beginning of July, I think that what we're seeing now is that we will need to continue with this level of support. So that's just a little bit about our virtual college. And if anybody does want to know any more, then please look at our website, and you can see all the videos and all the things that students and staff have been making to really help have that momentum and actually bring that motivation to learners, and to see the things that they're doing. For the Faculty of Inclusive Practice, we moved our timetable exactly from, we normally run 9:30 till 3:30. We just did that exactly the same, but we do it online now. So we still have home cooking with Karen as opposed to budget cookery. We have all the sports and enrichment activities that Mitch, one of our specialist mentors, is running so that students can access. Rather than doing a gardening session with Pete, he's obviously doing it all online, and we've seen some very creative bird boxes and sunflower seeds that have now been germinated and are starting to grow in learners' gardens. So there's been a huge variety, and I think that what we've seen is it is reducing that anxiety, not just around remote learning, but also about being able to interact with their peers on a daily basis, but also we've been able to see what they're actually doing, and that monitor through the Microsoft Teams and the chats, that type of interactions. So there's just some examples, really. Moving back to you, Jane, I think.
Sorry about that, I was on mute. So yeah, this slide just showing you actually some of the emotional health and wellbeing support that we've put in place, picking up on what Sam's just been telling you all about. And actually what we've done at key times when we know people have felt particularly isolated, we've sent out key updates to ensure that it's just reminding people that there's support in place. And that's not just necessarily support that we offer as a college through our welfare teams and through the BAM, but actually directing people to some of those other resources that are available, such as Samaritans, Young Minds, which again you'll all have access to. So as I mentioned earlier, we took the decision to invest in a tool called Big White Wall. We've had it at the college now for over 2 years, and the use of it is growing almost daily. And actually, at the moment, it's being taken up a lot by both staff and students. What Big White Wall is a portal that's available 24/7, 365 days a year. It does not replace professional advice, but actually what it does, it gives individuals that first point of contact that they might want to just hear from others. So there's a wall where you can post your thoughts and interact with other people. It's all anonymous, so no one knows who you are, so you can be really open about how you're feeling. Sitting behind that wall is a team of counsellors, and anything that's triggered, any phrases or words that trigger kind of concern, they step in and then start to support an individual. But it's a safe space where people can interact and just share how they're feeling if they're feeling particularly vulnerable or isolated. Another part of that service is a self-help portal. So it has links to pretty much every service and every type of support that you would need, from anxiety and generalized anxiety disorder, from low-lying depression through to post-traumatic stress, eating disorders, feeling stressed, bullying, all sorts of things. It's a fantastic tool. And actually, you know, as you can see from those statistics there, it particularly helps people who are feeling isolated. And just bearing in mind, right at the beginning of this presentation, we talked about only 31% of people feel that they can talk about their mental health. You know, that's really important, that they have somewhere safe that they feel that they can go and find that support. And for us as Weston College, I just thought it would be useful to any of you who might think about this tool, sharing with you some of the information that we've got back from Big White Wall. They provide us with reports on the usage, and as you can see there, 64% of our staff felt that it helped them be more productive, and that 88% of respondents felt that they felt better after using Big White Wall. And actually only a third of respondents used Big White Wall as their only source of support. Again, bearing in mind right at the beginning of this webinar, we talked about a 3 to 4 month delay in getting any talking therapies through the GP. That's really important. I'm not saying this replaces talking therapies, not at all, but actually if there's a 3 to 4 month delay, what we understand about mental health and how it can escalate and escalate really quickly, you know, we have a duty to support people and step in and help them with that support before they get any formal support through a GP, through a counsellor and through a talking therapy. And, you know, 69% of students felt more able to ask for help. I mean, how fantastic is that if we look at that impact on the economy of mental health and the statistics we investigated earlier about organisations wanting to do more, but they didn't feel they had the training in place, and that employees wanted to speak to somebody about how they were feeling but didn't feel that they could. How fantastic that something like this can help open up those conversations, but also support people in those early stages where they just need a bit more support. Again, we can provide lots of information about Big White Wall. They presented at our mental health conference on the 5th of March. So we've got, you know, lots of information. If any of you want to have further conversations with us about it, please let us know. And I see that there's, Helen, you've asked how much it costs. I'll need to check with the welfare team. I think it was around £5,000 per annum based on a certain number of users. Actually, Sam's just confirmed it's 7,000 plus VAT. So it is an investment, but actually, if you're an organisation that employs a lot of people or has a lot of customers, it is an investment, and it really helps with that duty of care and that legal requirement to support people. And just something to mention about Big White Wall, so any of our staff and any of our learners who enrol on a course have access to this. So, you know, it's a tool that's available to any of you if you're putting learners through Weston College. So just to summarise, because I know we're starting to run out of time, if we look at mental health, the core topic of today, we've covered communication is critical, and if you take nothing away from today's webinar, I would plead with you all to start communicating and actually break down communication barriers within your own organisations and support people, both support employees but also managers to be able to support employees. We've talked about some of the training and development that's available for that support, but obviously, we are quite a few years down this journey, and we've learned a lot along the way. So please, if any of you want further information or to have a conversation with us about our approach, we'd love to help with you. And then equip, so those platforms, those tools, those signing mechanisms, there's a lot of information available out there. Big White Wall is an expense, and it is a tool that you would need to buy in, but actually there's a lot of self-help portals out there that are accessible and free of charge. So if you do nothing else, think as an organisation about how you can signpost people to help themselves. And I just wanted to talk about our Fresh Start campaign. We're actually going to run a separate webinar on this, but we were granted Business of the Year in November by Lloyds, and we wanted it to have a legacy. And thinking about everything that we've talked about today around mental health, we're passionate about linking with employers and linking with our partners in the FE sector to provide learners an opportunity who might have been discounted previously from recruitment processes because they've had a break in their employment history, maybe because of a mental breakdown or depression or lots of different reasons. And actually, you know, what we want to do is work with a whole network of people through the employability hub of the SEND Centre to create opportunities for learners to, and for employees to gain better opportunities, either through work experience or through apprenticeship. So we'd love to hear from you, and we'll send some further details around the Fresh Start campaign. There is a video that's available and it is so powerful. Again, we showed it at the 5th of March event, and it's about one of our lecturers here at the college who came out of the forces, and he had a breakdown and he was homeless, and then he got a job with Weston College, and he's now doing a degree and lecturing. And you know, if you'd taken his CV at the point when he was at his lowest, how many of us would have discounted him? And actually, he is a real asset to our organisation, and you know, our students love him. And that's kind of really, sort of in a nutshell, summarises what we're trying to do with Fresh Start. It's about creating those opportunities and giving that helping hand to people who might have experienced mental health problems. Just a quick, before I hand back over to Dave, we are running another webinar on the 1st of July with Nick Elston. Nick did a seminar at our 5th of March conference, and the feedback from the 420 people who attended was, you know, we want to hear more from him. So we've actually been very lucky in booking him for our next webinar. We'll send some details out to all of you, but you know, please join us, because he's fantastic, and he's experienced you know, a breakdown himself. He suffers from anxiety, and his story and how he's now using that to support businesses and organisations is fantastic. He's really inspirational. So please join us. We'll send you some details afterwards. So I think I'll hand back over to Dave now. Thank you.
Lovely. Thank you very much, Jane. I do appreciate we've just hit the 1 minute past 2, but if you'll just allow me to describe what's up next. Thank you to our speakers, Jane and Sam, and our questions that come through the chat box. The Wednesday Working Lunch series will only be as successful as those who attend and engage. So to get 160 plus attendees has been great. Join us next week at this time with James Short, former British Army General, 34 years experience. He's going to be talking about leadership in a crisis, something quite important. And I think we can learn a lot from James. He's a great guy, a fascinating character. You have the link already. I'll send it out again. We hope to see you next week. From us to all of you, thanks for joining, and we'll see you soon.